Welcome to Getting Your Dream Smile with Cosmetic Dentistry. This is where we discuss and help patients get what they want in a smile while being totally informed. Whether it is porcelain veneers, bonding, whitening, or Invisalign, you'll find out what is best for your situation. Everything you should know, where and who to see, and all the costs involved. Stay tuned.
Welcome back to Getting Your Dream Smile with Cosmetic Dentistry. My name is Sabrina, your co-host for today, and I'm currently a pre-dental student at UCSD, and I work with Dr. Esham to inform the public about the best way to achieve your best smile with cosmetic dentistry. Our podcast discusses the benefits and what you need to know about cosmetic dentistry. Today, we will be talking to Dr. David Esham, who has been practicing cosmetic dentistry for 25 years and is credentialed from the American Academy of Cosmetic Dentistry and specializes in invasive cosmetic dentistry. Let me introduce you, Dr. David Esham.
Hello, everybody. I'm very excited about today's podcast because we get to talk to some wonderfully beautiful and intelligent young ladies about one of my favorite things in cosmetic dentistry, which is doing Invisalign. And so we have Sabrina, who is an Invisalign patient, and we have Amber, who is our treatment coordinator for the Invisalign office. And then we're honored to have Carly, who is our Invisalign rep for Southern California and Hawaii. Is that right too? But
Yes.
anyway, okay. Anyways, they're here today and they're going to let the audience know about Invisalign. A lot of patients don't think of Invisalign as a method to have their smile enhanced. They usually think about porcelain veneers or something like that. But here at my office, we use Invisalign as our first go-to treatment to get somebody to have their best smile so we don't have to grind on their teeth. And so I'm going to let the ladies take it from here, and they'll be able to tell you their experiences and what other patients' experience have been with Invisalign and cosmetic dentistry. So go right ahead, Sabrina.
Awesome. So I guess I'll ask the first question to Amber. Why do you think Invisalign is so important for cosmetic dentistry, and what do you think is the best patient for Invisalign?
Well, to start off patient-wise, I think patients don't realize themselves that they're a good candidate for Invisalign. I think we forget, even as me as an Invisalign coordinator, forget being with Dr. Esham and how great he is at his cosmetic dentistry. The patient's natural teeth are the best ultimately, and I think people forget that, or patients forget that, and don't realize they can still get that outcome with using their natural teeth instead of having to go to veneers.
Yeah.
So I love that aspect that Dr. Esham provides to patients to allow them to keep their natural, beautiful teeth and get those same results. So it's a really fun process. But I think all patients are wonderful for Invisalign. Again, it's a great way to straighten the teeth, socially acceptable, how easy and convenient. And the results that they get, it's just such a life-changing experience. And you see those results at the end and the smiles on their faces and the excitement because they have their teeth, they look amazing, and they're happy. So it's a fun process.
Yeah, that's amazing. And I can relate to that since I also am an Invisalign patient, and I know that Carly is also an Invisalign patient. So maybe do you want to talk a little bit about your journey and your connection to Invisalign and why you think it's so great?
Yeah, so it's funny how I ended up in my own Invisalign treatment as the Invisalign rep. I had ortho as a teenager, and my teeth were seemingly straight. However, I was never super confident in my smile. And it's funny because sometimes people look at me and say, "What are you talking about? You have straight teeth." But I just felt something was off. And I without my knowledge of dental at the time, I couldn't put words to it. And I didn't know what was missing or what didn't feel right. And ultimately what was missing from my smile is wideness. So I had very narrow arches, and though my teeth were straight, I didn't have crowding or spacing. Everything was fitting nicely together, but I just had very constricted arches. And I never knew that that was something that could be addressed. I thought that was just how you're born and you're stuck with it until I actually started working for Align Technology, who is the parent company of Invisalign. And I received a scan myself and was simply told, hey, if that's something you're self-conscious about, it can be addressed with Invisalign. And now, I mean, I'm still in my treatment, almost done, but every time I look at a photograph, I zoom in on my own mouth and I'm like, I never knew that I could have that. I thought I had to just settle for what was my current dentition.
But isn't that funny when you are coming for that? We, in our consultations, will tell patients all the time how we want to widen and broaden their smile by bringing out their arches. And they like, oh my gosh, I didn't even know you could do that. Or it wasn't even a thought in their mind that we could fill their smile. And so all people see is the white teeth that they're displaying now that they're all nice and straight. So it's fun.
Yeah. And I think it's really important to explain what constricted arches are. Basically, when you think of a celebrity smile, like good old Julia Roberts, just has a mouthful of teeth. Like she opens her lips and it's just teeth in your face, like this gorgeous, big, huge, wide smile. So that's an example of a very broad, widened smile, which she most likely achieved through her own orthodontic treatment at some point in her life. But when I smiled, because my arches were constricted, I had black spaces, essentially just kind of black gaps between my teeth and my cheeks.
Yeah.
So my teeth, really only my front teeth were showing when I was smiling because of my narrow constricted arches. So constricted arches are just kind of like tight smiles, I guess you could say. Whereas you think of the opposite of constricted arch, which would be someone like Julia Roberts with the big, wide smile, mouthful of teeth.
Yeah, well, that's amazing. I think it's such a great way. There's so many different people that can qualify for Invisalign, and so maybe Amber, do you want to go over the types of patients that you see that come in for Invisalign and what certain cases that you come across? For example, for me, it was crowding, and I know for Carly, it was just she had a very narrow smile.
Oh my gosh, we see all kinds of cases, which makes it very fun when you do a consultation with the patient, because anytime we do a consultation and go over what a consultation consists of, it's really explaining and expressing that we're putting together a smile design for them. So you're really trying to get them to envision what their teeth could and will look like with the Invisalign treatment. So that is probably the most fun I enjoy doing. But yes, I mean, we see just very minimal where maybe just one tooth can be slightly out of alignment, and to that person, when they take a picture from a certain angle, it just bugs them tremendously, and they know it. And they'll say all the time, oh well, people think I'm crazy for coming in here, but it's something that will make them feel more confident, and they know that. So we see that, and we see all the way to severe cases, whether it's spacing or crowding. And those are the life-changing ones, I feel like, because it's those patients who feel like they have no options, really, like they don't qualify, or they're not a candidate, or they're stuck that way. So we do very, again, moderate cases to very severe cases, and it's just a wide range, which makes it, a fun process.
Yeah, and I think that's so amazing because that just opens up the options for people with many different smiles. And like Dr. Esham said in the beginning, some people don't think about Invisalign for cosmetic dentistry, but it's one of the first options that we provide with our patients, especially when they come to our office. Or it would be great to look for an office that does the same for you, because we want to make sure that you can use your natural teeth as porcelain veneers, or keep those beautiful natural teeth and don't have to grind down on them or don't have to add any other material. And I think that's why Invisalign is so amazing, and how there's so many options with Invisalign. So maybe.
Well, to your point, Sabrina, not all patients do consider Invisalign when they're walking into a cosmetic dentistry consult. And a lot of times the reason for that is, at least what I see on my end, is, believe it or not, every cosmetic dentist is not offering Invisalign.
Yeah.
There are many instances where I'll come across a doctor's office and they have the big cosmetic dentist sign in their window, yet they're not an Invisalign provider.
Mhm.
So I think that's very important for patients or consumers to consider, that when you're looking to do a consult with a cosmetic dentist for some sort of cosmetic dental treatment, I think that you should absolutely make sure that the doctors that you're seeing are Invisalign providers, so that they can give you that holistic approach and give you as many options as possible. Because what I see a lot of times when a patient walks in asking for veneers, a lot of dentists maybe see money signs and they say, great, this is an easy case for me to all of a sudden just grind down on this patient's teeth and put as many porcelain veneers on there as I need to. Treatment's going to be what, maybe, I don't know how long a veneer case takes, maybe a month for it to
Pretty
come back
short,
from the
yeah.
lab and whatnot. And the doctor pockets that money, and now a patient has lost significant tooth mass.
Yeah.
And maybe those veneers don't even last them the full 10 years that they're anticipated to, or that they're supposed to, because that foundation wasn't created first. So the way I always like to think about it is, when you are building a home, you need to make sure that that foundation is built on solid ground and that you have a solid structure in place before you worry about the beautiful marble granite countertops and the luxurious wood floors. If you don't have a solid foundation, all of that is not going to last. So when you're going to a cosmetic dental consult, in my opinion, I think that Invisalign should always be presented unless the patient somehow has already finished Invisalign, maybe at another office, and then you're the dentist that they referred the patient to for bonding or veneers to do the finishing touch. But as patients and consumers, I think that's something for you to raise suspicion to, or even just ask the doctor, hey, do I have a solid foundation for these veneers? Are these veneers truly going to last me as long as you're telling me they're supposed to, based on where my bite is and how my mouth fits together? And yes, Invisalign is the longer approach to that, right? We're quoting maybe a month, 2 months for a veneer case. Invisalign is going to add at least 6 months, sometimes less, but I would say the average Invisalign case is maybe 6 months. What do you think, Amber?
Say anywhere between 6 months to a year, just depending on what needs to be accomplished with their smile. But to kind of take on from what you say, you're right. Cosmetic dentists will just go out there and place all these veneers. And when we present or do a consultation with our patients, it's not just wanting to throw veneers on their teeth, because like you said, you need that solid foundation. But it's really allowing them to keep as much tooth structure as possible, but maybe not needing that many veneers at the end. So instead of 8, maybe only needing 4. So again, I think putting together that smile design and having those options really helps the patient in the long run, not only for that foundation, but again, their pocket as well. Another thing that I love that a lot of people don't get, at least from what I hear from them having other consultations, is it's just giving them a cost, but not really expressing what can be done with their smile. So we like to, I mean, Dr. Esham's been doing cosmetic dentistry for so long and is so wonderful, but he takes those expertise in cosmetic dentistry and applies them to his Invisalign patients. So again, they're getting his cosmetic dentistry with their natural teeth. So it's really fascinating, and I mean, just a great service that these patients could get. So yeah, it's nice.
Yeah, and there's obviously health benefits to Invisalign as well. And, you know, for my instance, where when I went into the doctor thinking it was solely cosmetic, that I just wanted my Julia Roberts wide arch celebrity smile, realistically, what we also identified is that because of my constricted arches and my very narrow arches, my teeth weren't fitting together properly. Even though they were straight, I had a lot of recession, and I actually had a lot of tooth wear happening because my teeth were not fitting together properly. And as my dentist described, forces were not evenly distributed because my, once again, narrow arches, they're taking impact where they shouldn't have. So I've noticed myself that headaches have been alleviated. Now, thanks to my wide smile, my teeth hit properly. it's what we call occlusion. I have healthy occlusion now, or for patients, all you need to know is that your bite fits perfectly together now, or your bite should fit perfectly together after Invisalign. And I've noticed my headaches have been alleviated. My jaw feels significantly better. I notice I'm not clenching and grinding significantly as much. And additionally, the sensitivity of my lower teeth is gone, I would say. And it's once again because now the forces of my bite are evenly distributed because my teeth have space now.
Yeah.
So there's so many health benefits to straightening your teeth and thinking about a holistic full mouth approach versus just what we call like single tooth dentistry.
Yeah. When you smile, we see a little Julia now, don't we?
It looks amazing.
It's a best compliment.
And I think I can relate to the whole health benefit part, especially with my crowded teeth. It was really easy for me to get food stuck in between my lower teeth because they're incredibly crowded. And I know that once I straighten them out, it's not going to be a problem anymore. But let's say I kept it crowded, then it's really difficult for me to floss, and it's difficult for me to get out food. So then my risk of getting cavities or just like damage to my teeth is incredibly increased. So it's great that Invisalign is not just like, oh, it's an aesthetic purpose. I just want to make my teeth look nice. There's so much more to it in terms of your health, in terms of your looks, and just in terms of saving your tooth structure and making sure you made the right decision. And I think a key point that I always like to mention that Dr. Esham likes to make is that you can have nice furniture and your teeth can be really nice. They're just not in the right place. And Invisalign is the perfect way to get them back into place, and you get a nice home for your teeth, and they're all perfectly straight. So I think that's an amazing part about Invisalign. And so maybe Amber, do you want to go over like the process of getting Invisalign? Maybe like throughout the whole journey.
Yeah, of course. So you always want to first by finding an office, and you want to do that free consultation. Again, you're not only looking for a great provider service results. You're looking for an office that you can relate to and have good, appointments with, and it's family ultimately, because you'll be with us for a little bit. And then after you do that consultation, we start by putting together that smile design. So when you come in for that consultation, we take all those records that we do with you at that appointment, send it off to Invisalign, and that's where the doctor really goes in with Invisalign and designs what you guys had discussed. Keep in mind, and we always tell our patients that they're part of that smile design. They're their teeth. It's, we want them happy at the end. So they're a part of that process with us. And then your trays arrive. And fabulous thing about Invisalign is they make all the trays at one time. So it's really incredible, the technology and what's behind it. And then with our office, you have options. You can come see us every couple months for your appointments. We check you. We monitor how the treatment's going, if you have any questions. And then, or you can go virtual, which is really something that's been taking off and really great as far as taking your trays with you, and you actually check it in with us, weekly for with progress photos and so forth. And keep in mind, even though you're virtual, you still have access to us all the time. And then once you get through all those trays, we really analyze your smile. How does everything look? Did everything move the way we wanted it to? And we go from there as far as you being done, or we do some, final enhancements. So really simple, easy process. But again, it's just doing your research. I like to recommend to people who reach out if they have questions in regards to Invisalign providers. I tell them to go to Invisalign.com. You can type in your zip code. And the cool thing is it will list all the providers near you. It will tell you how much Invisalign they do and how experienced they are. So if you ever have any questions on that, I always educate to go there, and it really helps to guide people on making that decision and that choice.
Yeah, and to Amber's point, a lot of times patients don't know what all Invisalign entails. Invisalign is not your parents' braces. Invisalign is not your braces that you had as a teenager. A lot of patients hear the word orthodontics and they remember headgear, and they remember metal
paint
metal
that-
pokey things on their lips, and maybe even getting bullied or getting food stuck in their metal brackets. Invisalign is a clear aligner. For those that are not aware of what it is a removable device. If you have a date, if you have a big work event, you can simply take out your aligner and proceed with your life. So it is a life-changing product, but it's not going to disrupt your life, such as having metal brackets and wires in your mouth did from your memories of a teenager, or maybe your kids' braces that they had. So Invisalign, yes, you need to be compliant. We do recommend and ask that you wear your aligners for 22 hours a day. However, I think it is important to remember that you are human, and that is the beauty of this product, that you can continue about your life without huge disruptions in your lifestyle. So you're moving your teeth almost silently, especially in today's society where you're wearing a mask everywhere. You're moving your teeth almost silently, I like to say. And then one day you look back, and Sabrina, you shared this with me earlier, that you had actually forgotten where you started, because the movement, your eye doesn't always detect or remember what it looked like yesterday. But then you look back over the series of the past 11, 12 aligners, or however many aligners it may be, you go, oh yes, I remember where I started, and this is where I'm at today. So it's actually a really fun patient journey and experience. And the more you see your mouth changing, I think the more motivated you feel as a patient. Like, oh yes, I have to remember to put my aligners in after lunch today, because I want that movement to happen. And something that's really important to note from Amber, yes, you can search for an Invisalign provider in your area. However, I can't stress enough the importance of finding someone with experience and making sure that you're getting the best care possible. So while Invisalign is not brackets and wire braces, there are other clear aligners out there on the market. And truthfully, Invisalign is the #1 clear aligner. It is the best technology, and it is the safest and most predictable for moving your teeth, with the guidance of a experienced doctor. So I always like to tell the analogy to my friends who are looking for an Invisalign provider or have questions about, how do I find an Invisalign provider? I share the analogy of, an athlete can go buy the nicest pair of cleats, and they can put those cleats on, but they still need to know how to perform and do whatever sport they play, right?
Yeah.
If you're playing football, you still need to know the plays, and you need to know how to do that activity. Whereas, yes, Invisalign is the #1 clear aligner in the marketplace. It is the most predictable and safest for your teeth. However, at the end of the day, it's in the hands of the provider that you choose.
I think that's so important. And I think for me, before, I thought, oh yeah, it's just Invisalign. Every dentist is gonna be the same. They just submit my case and that's it. And that was my perception at first. And then I came to Dr. Esham's office, and he explained to me that no, like, the dentists themselves like dictates like, oh, I want to move this teeth this way, or I want them to widen out their smile. And that really changed the whole perspective of Invisalign for me, because it's not just like, yeah, you'll submit your scan and get your trays wherever. You really do have to find the right dentist for you, someone you feel comfortable with, someone who has a lot of experience. So definitely do your research on how many cases they've done, because like Amber said, you can get, like, with Dr. Esham, his cosmetic dental experience and his knowledge into your Invisalign case, and that's really great, because you do want perfectly straight teeth and that look nice for you. And a big thing is that for me, it was just a big confidence issue that my teeth were just not straight. And I think with Invisalign, and being at the age that I am, I'm in undergraduate college, I didn't really want to put on brackets on my teeth. Like, even with masks now, I know that when I take them off, I'm not going to be happy with how I look. And even before that, without the brackets, I was not happy. So I was so glad to find Invisalign and have Invisalign as an option, because it was just clear aligners. And sometimes I'll smile to people and they're like, do you have it on? You need to put it on. It's supposed to be on for 22 hours. And I'm like, no, yeah, I have them on. And like, it's so great, because not only that it's clear, like you said, Carly, I could definitely see the difference that it has made on my smile. And since it has been something that I've been super insecure about for, the past 20 years of my life, seeing like the smallest change in angles of my front 2 teeth were just so amazing to me, and it like really brought out my confidence that I did not know was there. And I could tell that I wasn't covering my smile or like covering my mouth when I was laughing, and it really just does bring out the best in you. So beyond the aesthetics, it can really make you happy. I've seen myself blossom as a person, and I didn't think that I could, show this much confidence and be this happy and show it off. So it's overall such an amazing option to have, and everyone should be able to smile confidently, and everyone should be able to be happy in their own skin. And I think Invisalign is just an amazing route for people to do that. Before any cosmetic treatment, I think Invisalign is always a great option to keep in mind.
Yeah, I like to tell people, warning, the side effect is that you look good. The reason you do it is for your health and for the function of your teeth. Teeth are supposed to last you your entire life.
Yeah.
And having the right dentist and someone with the proper experience, they'll make sure that that's the case for your mouth.
So I feel like when we see patients and you get to know them during their consultation, you kind of have 2 groups, right? You have people who come in for cosmetic purposes, and I think the majority is cosmetic. Then you have the other group, it's for health. So they don't really, it's like, they went to the dentist and they have this crowding, or they might have, perio, and whatever the case is. So when you have those 2 different categories, you tell the person for cosmetic reasons, hey, this is not only going to give you that cosmetic, but you're going to get the health benefits as well. And then you tell that health patient who's there for that, you're going to get the health, but you're going to get the beauty behind it. And it's expressing to that patient too, they're not only going to have it's not just about having straight teeth, right? I mean, anybody can have straight teeth. Yeah. It's about making them look good while you do that. So I think that's missed a lot of times because, again, it's putting that design and that cosmetic background behind it. So that's what makes it so wonderful.
All right. Well, I think this has been a great episode for our patients to learn a lot about Invisalign. Do you guys have any last words that you might want to get out, or just some summaries and messages to the viewers?
Yeah. Schedule a free consultation. It doesn't hurt. There's no commitment. It gives you that information. See what's out there. Educate yourself. Learn about the doctor, and see ultimately what it could do for you, and be part of that smile design. It's fun. It's easy. And we're always here to answer any questions if you ever need anything.
Yeah, I think just to reiterate everything that I spoke about is I can't stress how important it is to pick an experienced provider and make sure that your treatment is in the hands of an expert.
Awesome. Well, thank you so much, Amber and Carly, for spreading your knowledge and giving your little stories. I think it's so amazing to see what Invisalign means and what Invisalign provides beyond what most people think is just straight teeth. We hope this helps you patients out there figure out what's best for you and how to figure out the right Invisalign provider. Other than that, be sure to subscribe to our podcast, leave us a rate and reviewing on Apple Podcasts. And if you have any questions concerning your teeth, be sure to click the link in the description, and you can ask your questions there and we can answer them in future podcasts. Other than that, I hope you guys enjoyed, and we'll see you next episode. Bye.
Bye.
Okay.
Thank you for tuning in to Getting Your Dream Smile with Cosmetic Dentistry with Dr. David Esham. Be sure to subscribe to our podcast to be notified about future episodes. Click the link in the description to fill out a form if you have any questions on cosmetic dentistry or your smile that you want us to answer. See you next episode.